As clinical dentists, we strive to maintain the vitality of a healthy tooth pulp. In the pre-clinic simulation, we don't have pulp vitality to consider. In clinic, we will do some things differently. Mainly we will use water as a coolant when using high speeds with the handpiece. This lecture covers basics of what dentists do for the health of the tooth. With us today is Dr. Tessa, an expert in dental operative procedures.
Thank you, Anne. I'm pleased to join with you and your audience.
In another lecture, we will discuss how to treat a tooth with a pulp that has been affected by caries.
Teeth possess only pain receptors. Thus, if the tooth encounters something hot or cold, it is interpreted as pain. Injury to the pulp is registered as pain. Any inflammation of the pulp followed by healing is referred to as reversible pulpitis. If inflammation is followed by pulpal necrosis, this is referred to as irreversible pulpitis. And the only options at this point for the tooth is to extract, that is, take out the tooth, or endodontic treatment, that is, take out the pulp and place a root canal filling material in the pulp spaces.
What sort of injuries are we talking about?
In general there are 4 types: mechanical, physical injury, thermal injury, chemical injury, and bacterial invasion. The first 3 are largely under the control of the operator. However, bacterial invasion of the tooth is much more difficult to prevent. Careless instrumentation by the operator may cause mechanical damage to the tooth and/or adjacent structures. Overzealous drying of the tooth can also irritate delicate pulpal tissue. Situational awareness by the operator is mandatory at all times. Use light pressure, let the instrument do the work. Desiccation of the dentin due to overzealous drying may have harmful effects and should be avoided. In aspiration, the cell bodies of the odontoblasts are sucked up into the dentin tubules. Desiccating the dentin leads to aspiration of the odontoblasts, which can lead to pulp death, that is, pulp necrosis. Gentle, intermittent drying of tooth structure will help. Aim the air across the preparation, rather than directly at the dentin surface. Iatrogenic injury is a word to remember. It is injury caused by the operator. How do we avoid creating a mechanical injury? The slide refers to prevention of both hard and soft tissue damage. Great care should be exercised at all times. Use of the correct, well-cared-for instrument, finger purchase, isolation, lighting, adequate anesthesia, along with minimal pressure and judicious application of air drying are essential to the prevention of injury. Heat-related injury to the tooth may be reduced by judicious use of water spray, minimizing applied pressure, and the use of suitable instrumentation. The use of dull, worn burrs should be avoided, as they generate more heat through increased pressure and friction. Normally, stones and larger burrs generate greater amounts of heat. Higher speeds also generate heat rapidly, and copious water spray is advised. Rotary instruments should be kept moving, and not allowed to dwell on any one particular area. Please review the causes of thermal injury and how to avoid. The use of chemicals on tooth surfaces may have detrimental effects and may be encountered with a number of materials. Pulpal injury may be related to the chemical applied, the length of time the chemical is in contact with the dentin, and the concentration of that chemical. All materials should be used in accordance with manufacturer's recommendations. The caries process is a byproduct of bacterial invasion. These bacterial byproducts damage the tooth structurally as well as cause inflammation of the tooth pulp. Periodic dental examinations as well as informed patient home care are essential to limit the threat posed by bacterial infection. Microleakage associated with dental restorations is also a potential conduit for bacterial invasion. The tooth reacts to the bacterial invasion by creating new dentin. This works best if the caries progression is slow. When the caries is acute, that is, fast-moving, the pulp doesn't have enough time to lay down new dentin. Biologic considerations also include remembering the enamel rods and the 90-degree margins. Rotary instruments alone do not always produce the ideal cavo surface margin. Hand instrumentation is required to produce the correct finish. Dentin has tubules which communicate with the pulp. When the floor of a preparation is near the pulp, the tooth is more vulnerable to injury because the tubules become larger in diameter, and there are more tubules per square millimeter. Health of the gingival tissue often depends on obtaining a physiologic contour of the restoration. If we over-contour a restoration, bulky in the gingival third, the tissue can react with inflammation because it is understimulated. If we under-contour a restoration, too flat in the gingival third or too bulky in the middle third, the tissue can react with inflammation because it is overstimulated. Correct contours on buccal and lingual yield healthy gingiva, given good home care. One more thought. If the contour is not 100% correct, it is better to be a tiny bit under-contoured than to be a tiny bit over-contoured. One more concern based of the tooth and its surroundings. Gingiva. In anterior teeth, the contours of the incisal half of the tooth are related to the soft tissue and lips. The gingival third of the tooth is related to the gingival contour. The proximal contact is an area of special concern. When we restore teeth, the gingiva will typically not be healthy if the contact area is too large, too small, and/or poorly contoured. In this lecture we have discussed various types of insult affecting teeth and their surrounding tissue. Thoughtful attention to detail and awareness of these pitfalls can provide an improved prognosis for the tooth and experience for all concerned. Thank you. Other videos are available for the interested viewer.